8 disturbing human experiments in history. The Tuskegee Syphilis Study. In 1932, a study began in Tuskegee, Alabama that would run for 40 years and become one of the most cited ethical failures in American medicine. Researchers recruited hundreds of black men, many of them poor sharecroppers, with the promise of free medical care. The men were told they were being treated for bad blood, a vague term used locally for various ailments. In reality, many had syphilis, and the purpose of the study was to observe the natural course of the disease. When penicillin became the standard effective treatment in the 1940s, the men were not offered it. Treatment was intentionally withheld. The disease progressed in many participants, leading to complications affecting the brain, heart, and other organs. Families were also affected through transmission. From a medical perspective, the study violated core principles: informed consent, beneficence, and justice. Its exposure in 1972 led to public outrage and major reforms, including stronger institutional review boards, IRBs, and modern informed consent standards. Today, Tuskegee is taught not only as history, but as a warning about how power, bias, and research goals can override patient welfare. Unit 731. During World War II, Unit 731 of the Japanese Imperial Army conducted large-scale human experimentation under the guise of disease research. Prisoners were exposed to pathogens such as plague, cholera, and anthrax, often to study disease progression and transmission. What makes this particularly relevant to medicine is not only the brutality, but the misuse of scientific method. Experiments were conducted without consent, without ethical oversight, and often without meaningful scientific controls. The data collected was therefore both ethically unacceptable and scientifically compromised. Modern biomedical research draws a firm line. No data obtained through unethical human experimentation is acceptable justification for further harm. International frameworks like the Nuremberg Code and later the Declaration of Helsinki emerged, emphasizing voluntary consent, risk minimization, and the primacy of the subject's well-being. The Stanford Prison Experiment. In 1971, psychologist Philip Zimbardo set out to study the psychological effects of perceived power. Volunteers were randomly assigned roles as guards or prisoners in a simulated prison environment. What followed was not physical experimentation in the traditional medical sense, but a powerful demonstration of how environment and authority can shape behavior. Within days, guards began to display controlling and abusive behaviors, while prisoners showed signs of acute stress, anxiety, and emotional breakdown. The study was terminated early. From a clinical perspective, it highlighted how quickly situational stress can produce symptoms resembling trauma, sleep disturbance, emotional dysregulation, and dissociation. Today, the experiment is widely criticized for insufficient safeguards. It contributed to stricter standards for psychological research, including continuous monitoring, the right to withdraw, and clear limits on stress exposure. The Milgram Obedience Experiment. Stanley Milgram's work in the 1960s explored a simple but unsettling question: how far will people go when instructed by authority? Participants believed they were administering electric shocks to another person as part of a learning experiment. In reality, no shocks were delivered, but the setup was convincing. Many participants continued to increase shock levels when prompted, even as they believed they were causing harm. Medically, the relevance lies in the physiological stress response. Participants showed elevated heart rates, sweating, tremors, and visible anxiety, clear signs of sympathetic nervous system activation. The experiment demonstrated that obedience can override personal moral judgment, especially under structured authority. Modern ethics now require that participants are not exposed to severe psychological distress without clear justification, safeguards, and debriefing. The CIA's MK-Ultra program. In the mid-20th century, the CIA launched MK-Ultra, a program aimed at exploring mind control, interrogation, and behavioral modification. One aspect involved administering substances like LSD to individuals, sometimes without their knowledge. From a neurological standpoint, LSD affects serotonin receptors, altering perception, mood, and cognition. In controlled settings, it can be studied safely, but in MK-Ultra, administration was inconsistent, unmonitored, and often non-consensual. Participants reported confusion, paranoia, anxiety, and long-lasting psychological effects. Without proper screening, dosage control, or therapeutic context, the brain is vulnerable to destabilization. The program became a defining example of why informed consent is non-negotiable in research involving the central nervous system. It also reinforced the need for strict oversight when studying psychoactive substances. The Monster Study: Speech and Psychological Harm. In 1939, a study, later known as the Monster Study, investigated whether stuttering could be induced in children through psychological conditioning. Children in an orphanage were divided into groups. Some received positive speech reinforcement. Others were subjected to persistent criticism and negative feedback about their speech. Those in the negative group began to show signs of speech anxiety, reduced verbal output, and long-term confidence issues. The study demonstrated how powerful language and expectation are in shaping cognitive development. From a clinical perspective, it reinforced that speech disorders are not simply mechanical. They are deeply connected to emotional and psychological states. It also stands as a clear violation of pediatric research ethics. Vulnerable populations require heightened protection, not exposure to harm. Radiation experiments on uninformed patients. During the 1940s and 1950s, various studies in the United States exposed patients to radiation without fully informed consent. In some cases, individuals were injected with radioactive substances to study distribution and effects. Radiation, even at controlled doses, can damage DNA, increase cancer risk, and affect rapidly dividing cells. The issue was not only the exposure, but the lack of transparency and consent. These cases led to stronger regulations around human subject protection, especially in oncology and radiology research. Today, radiation exposure is carefully calculated, justified, and disclosed. Patients must understand risks before participation. The aversion therapy experiments. In the mid-20th century, some institutions attempted to treat behaviors, particularly sexual orientation, through aversion therapy. Techniques included pairing certain thoughts or images with unpleasant stimuli, such as mild electric shocks or nausea-inducing drugs. From a modern medical perspective, these interventions were based on incorrect assumptions about human behavior and identity. Instead of producing meaningful change, they often caused psychological trauma, anxiety disorders, and long-term emotional harm. Neuroscience now recognizes that identity and orientation are not conditions to be corrected. These experiments highlight how cultural bias can distort medical practice, leading to interventions that are neither effective nor ethical. They contributed to a broader shift in medicine toward evidence-based, patient-centered care and the rejection of harmful, non-scientific treatments.